Hi everybody, I'm Dr. James Kennedy, East Texas Foot and Ankle Centers. I treat lots of things here at the clinic, but one of the things that I treat is patients with wounds, sores. I treat a lot of my patients that are diabetic or geriatric. I actually have a lot of patients that are younger with wounds, but what causes wounds and how do you treat them? Well, let's get back to the diagnosis. What causes them? Well, if you look at these foot models here, I have several different foot models, and if you look at some of these, if you look at this foot model right here, you see a person with wounds, sores on their feet in between the toes, calluses, ingrown toenails, fissures. Well, believe it or not, these fissures can turn into things that are even larger. For example, if you look at this foot, that small crack becomes a small blister. Then it can turn into a stage 1 ulcer, then a stage 2 ulcer. And if it gets more severe, you can start to have ulcerations like these that go from stage 1, stage 2, stage 3, and then stage 4 ulcers. Pretty severe. These can be down to bone, and a person can develop gangrene, and sometimes they can lose their foot. So if you look at these foot models, as gruesome as they appear, this is reality. So if you're looking at this ulceration, this is toes that have peripheral vascular disease in them, and what's happening is these feet are malnourished. They're not getting enough blood flow. So if you're looking at this foot, this person's already had an amputation. This second and third digit are starting to become gangrenous, and if you look at this, this has an ulcer due to what we call Charcot foot. So the foot is actually having a rocker bottom deformity underneath. So this patient has a severe problem. Okay, so how do we diagnose the beginnings of peripheral vascular disease? Well, if you look at this diagram right here, this is the blood flow tree, the gross blood flow tree to a foot. So you have the posterior tibial artery right here, you have the dorsalis pedis artery, and then you have the peroneal artery up here. So the red is bringing blood and nourishments to the feet, and the blue is the veins that bring the blood back up to the heart. So this has to be working simultaneously to make sure you're not getting edema, you're not getting malnourishment to the feet. So how do we test for lack of blood flow down to the feet and then back up? Well, I do a simple test called a peripheral vascular disease test through this machine called a PadNet. So if you're looking at this diagram here, you're looking at the heart, and again, the red vessels are going down to the feet, bringing nourishment and everything that you would possibly need down to the feet, and then you have the blue, called the veins, going back up to the heart. So what we do, we put cuffs on with this PadNet, and we're testing for different types of blockages in the feet. So if you're looking at this small little diagram, you have a vessel, and this is the picture of the vessels directly on the poster. You see this area right here, this hole, this is called the lumen, and this is where blood flow goes through. Well, if you start to develop what we call a little fatty streak inside there, if you look at right in here, you have a small fatty streak in here. You really can't see it, but as a person that starts to develop peripheral vascular disease, you start to develop a fatty streak in there. If you look at this, now you're starting to have an arthroma right here, whereas you're starting to have a small blockage here and more of a significant blockage here. That's why a lot of my patients have swelling, pain, edema, all sorts of things like that. And then if it's severe enough, you can actually have what we call a blockage. Okay, that's very severe, and that gets to the gangrenous feet that I see on a daily basis. So if you look at this, this is actually a true blockage, a blood clot inside of the vessel. So what I use this machine called the PadNet, and it has several different types of it has lots of cuffs, blood pressure cuffs, that you're actually comparing blood flow down to the lower extremity. So I'm actually going to perform a test today, and I will show you what's going on with the patient. But it's really neat to see a patient going through one of these tests, because we can determine if the patient is having peripheral vascular disease. Okay, so now we're going to see the patient having this test being performed. Okay, we have a patient here that we think could have peripheral vascular disease. if you look at lower extremities as we mature in age and get a little bit older, they start to swell, and that's one sign of having possible peripheral vascular disease. So what we're doing with this test, we're comparing upper arm blood flow to lower extremity blood flow. So if you look at the two extremities that we have on our body, the upper extremity and the lower extremity, typically it's the lower extremity that suffers the most because that's the furthest from the heart. So if you look at what is the furthest part from the heart in the body, obviously it's the toes. So what we're doing, we're actually taking the upper extremity blood flow and we're comparing it to the lower extremity blood flow. So we're actually taking a look and comparing waveforms from here to here, and from here to here, and from here to here to see if there's possibly a blockage. So there's different types on the sheet that we get back, and it's showing non-compressible arteries. It also shows normal, and it also shows mild, moderate to severe peripheral vascular disease. Well, obviously this patient is not going to have severe peripheral vascular disease, but this patient could have mild to moderate. So if you're looking at these toes, one of the reasons why we're doing this is because she's having some pain here and here. Well, if you look at these toes, you have a small callus right here. If you're comparing this to this to this to this to this, you notice that these toes are a little bit discolored, and this could mean possible peripheral vascular disease. So what we're going to try to do is see this test, and we're going to see if the patient does have peripheral vascular disease, and if I can't treat it, I could send them to a vascular doctor to see if we can get this to the fact that, or get it to the point to where she's not having discomfort. But this is the reason why we do what we call a PADNET test, or a peripheral artery disease test. Okay, thanks for watching, guys. Appreciate it.